All right, good morning. So, this morning, what I want to talk about is something that we dentists, or really everyone in the dental industry, is responsible for. So, what we're talking about is forever chemicals, and they're used in virtually every industry. It's not just dental, but there are some ways that we use them that might surprise a lot of patients and people in the industry. So, what are they? These chemicals are unbelievably useful. What makes them so useful is this bond between a fluoride, which we see in a lot of, and this carbon over here. These two, this is the strongest bond in nature because fluoride loves electrons and carbon is okay with sharing them. So it becomes this incredibly strong chain. And before this was even made, scientists knew it was going to be a problem because while it's incredibly strong and nothing can break it apart, it can also bond to things in nature. And that is obviously a problem. Now, what makes this so incredible is that nothing can break it up. So it has a lot of uses. And that is why they call these the per and polyfluoroalkyl substances, or PFAS, are called these forever chemicals. They take many years to break down. And they have these unique properties because they repel everything. They can stick to each other, making these long chains. They're useful in a lot of different things. And in dentistry, we have a lot of very difficult problems to solve. And in some cases, we lean on these types of materials. So how are they used? First of all, they are non-stick. We all have heard of Teflon. And this means that, and let's see here, we got a little reaction. They stick together. So they use them in floss, we've all heard glide floss, and membranes. And they're incredibly stable, meaning they don't break down. So it's possible they are used perhaps in older formulations in composites or even in 3D printed materials where you want them to be stain resistant. And they lower surface tension because they repel each other. In fact, they repel everything. If you add them to water or other materials, it will break them up, which is why some types of impression materials use these types of chemicals. So dental floss, this one pops up a lot. There was a study in 2019 by the Silent Spring Institute that found that Oral-B Glide floss had higher levels of a specific type of forever chemical. There are thousands of them. And in fact, we don't even track all of them, but there's a few that seem to pop up. However, this study looked at 11 different ones of them. So there's a pretty good chance if you look at enough substances, one of them is going to be higher. They found that, of course, glide floss is about 20. It has Teflon, PFAS. It's about 25%, but not all types of, this is PTFE, Teflon, are necessarily bad because Teflon is such a long chain, it's considered to be inert. However, you are shredding it between your teeth. It could get embedded. So logically, there is concern, but studies really haven't borne fruit to this. We haven't really seen any specific instances of this actually happening. So how could it happen? It's an abrasive product. You're abrading your teeth, and your teeth are much harder than the floss that you're using. So you're going to end up with some fibers of PTFE around your teeth or your gums. It is inevitable. And the idea is you could absorb some of it or ingest it. And over years and years of this, it could make things higher. And again, studies, this is all theoretical. And the idea is it could accumulate in the bloodstream. And the reality is you have to make it. And the real problem with PTFE, or a lot of them, is it's very difficult to make. And there's certain types of other PTFE or PFAS chemicals that are used to make it. And there's a wide variety. Historically, they've found some, which is what nonstick pans were famous for, which they've since replaced with others that may not be any better. But the idea is that there could be contaminants within the PTFE, which is harmless in itself, that could then enter the body. And because it accumulates over time, it's not an acute type issue. It's years and years and from many different sources. We also use PTFE in barrier membranes. This is very common. PTFE membranes are incredibly useful because they can remain exposed to the oral environment. So you don't necessarily need to get tissue over the top of them. And in some are actually designed so they can tolerate partial tissue exposure. It makes them very, very useful for grafting. We use plumber's tape, which is basically an off-the-shelf tape. They do make some specifically for dental, and this is packed over the top of implant heads. This is really standard practice, and then people use it for all kinds of different purposes because, again, nothing sticks to it. So if you're doing a composite, it often can prevent it from going in places you don't want it to go. And finally, and most interesting to me, is it's found in impression materials. When you're taking an impression, there's often a significant amount of moisture or even blood around the object or what you're trying to get an impression of. And a very powerful surfactant is going to make it not bubble up. So you can still get an accurate impression in the presence of water or moisture. And this is one of the ways it's done. Now, there are some studies also. These chemicals, and this isn't unique to dental, it's used in manufacturing. So it's used in food, in stain-resistant coatings of plastic over food. And they found some of it in night guards. So it's not supposed to be in night guards. It likely was a contaminant from the processing of it. And PFOS, this is a chemical. It's being phased out, but they're still seeing it. Forever chemicals, they do exist in the manufacturing process, and they continue to be sent out. So these amounts are extremely small. They're not exceptionally high, but it does indicate that dental can be a source. And why does it matter? The idea is certain types of PFAS, there are thousands, tend to accumulate. So you don't have to drink or eat or ingest very much of them every day for them to slowly build up to a critical level. And again, even a parts per trillion amount can affect your health over long periods, and the health impacts are drastic. You don't need to harp on it, but there's many issues. And the risks, again, there's never been any kind of acute toxicity risk. I think it's more of an awareness type issue. But again, it really is a matter of your comfort. Do you really want to use PTFE? Some people just choose to avoid it. Is it worth phasing out PFAS in your daily life? And it's difficult to say, even though studies have yet to bear evidence to doing this, many people are just choosing to avoid these types of substances as much as they can. There are procedures, especially if you are a worker in a dental practice, that use these types of things. So impression materials, it's hypothetically things that are used in smoothing, can play a role. And again, it can play a role on a variety of different levels. So there's also a risk, especially when we use hand pieces, that some of these things could be heated up, especially if they contain some of these chemicals, or you could be aerosolized during the process of, say, you're accessing a screw hole. You may inadvertently significantly burr out some PTFE tape, and this kind of thing happens a lot. In theory, if you're handling these types of substance day in and day out, you could have a cumulative exposure to them. And again, workplace dust. If you're using these types of chemicals, impression materials from either a dental lab aspect, it spreads. So you could be contaminated from another area that has a concentration of these chemicals, or it could build up in your practice itself. And the environmental impact, you certainly could have an elevated level of these types of waste at a dental practice, especially if you're using a significant amount of impression material that uses this. If you're using PTFE tape, you may have a higher environmental impact. So you have to dispose of these appropriately. It's possible that this could affect wastewater. It can certainly impact how you take care of this medical waste. The regulations are, there's no effort to ban these at a national level. And again, the levels are so low, it may never happen. But again, the ADA has come out and said that there's no evidence to warrant changes in flossing. Glide floss seems to work very well. But other countries are starting to implement legislation. Maine, California, various other states that are starting to phase out PFAS products. And this would likely eventually affect the 3D printing industry. So, PFAS, these types of chemicals, have these incredible properties. And they have also been seen in the 3D printing industry, where various aspects of this that need to be, nothing needs to stick to them, like the films and resin vats have PFAS as well. Some resin formulations could possibly use PFAS, and they could be used in various aspects to make a better 3D printed resin. There are some alternatives, and again, I tend to use silk floss. There's there's other types of plastics as well, and there's other types of surfactants that don't use PFAS. So again, we have other options. You can use silicone. So again, the idea is, are they completely necessary? I would say no. For impression materials, that's a difficult question to ask, but there's certainly likely some impression materials that simply would not work very well without these types of substances. At least from a grafting standpoint, is there anything as good as a PTFE suture or PTFE graft for certain types of indications? And I would also say probably not. Do the benefits outweigh the cost? That's a difficult question to ask. And certainly what we don't want to do is have something that's not very useful, like a debubblizer or something for a lab impression or a separator that uses a ton of these types of chemicals and isn't strictly needed. So again, just talk about it. And the idea is just to have the conversation is really my goal from this. And generally we try to avoid PFAS products, or at least consider if they're strictly necessary for that indication, and be aware of what you're actually using. Again, the idea they are essential. They have a place. You can definitely deliver better care with them, but it's important to have an idea. And most likely they will begin to get phased out. There's certainly a push. I think people are starting to ask for this or demand that they're not. And the idea is to certainly make choices. And things are being marketed as PFAS, PTFE free. And I think the whole industry and the whole country is moving away from this. So anyway, hope you enjoyed it. It was a quick presentation. We will be back on Monday, and please follow if you enjoyed this. Thank you.